Okay, so let's get started and I'll keep an eye on the waiting room. My name is Christine Haythorne, and I am the CEO of the Parkinson Foundation, Western Pennsylvania. And I am delighted to have this kickoff meeting on advocacy. For the longest time, our organization, I think, has done a pretty good job of providing education and support groups and exercise classes. But it's become very apparent since Ray Dorsey's book came out and all the environmental issues that we now know are equated with Parkinson's disease that we we decided we needed to get more involved with advocacy. And we have a whole host of items that we want to cover that I believe many of you have heard about in the past. And it ranges from getting a registry in the state of Pennsylvania where we can um, not know names, but know zip codes of where people are who have been diagnosed with Parkinson's so that we may go to those communities and provide services. And, we can't solve a problem we don't know where the need is. But there are many other things that we would like to have happen in the PD community. Ideally, we would have the federal government put in place a ban on paraquat, a pesticide with a direct link to PD. But that's not happening anytime quickly. So we have seen other states, West Virginia, for example, who tackled the paraquat ban at the state level. And right now, that's what we're trying to do. So our initial focus on this call will be only on the paraquat discussion and how we should navigate as an advocacy team to push this through. We have the Parkinson Foundation Western Pennsylvania has a fairly long-standing relationship with the Michael J. Fox Foundation when it comes to advocacy. We now have another joint venture with them on research, but we've been active in an organization called UPAC, which is the Unified Parkinson's Advocacy Council. And so it is through UPAC and our discussions with that team that we've identified the baseline language to put in place a registry. It's through UPAC that we are pushing this paraquat ban in the state of Pennsylvania. So they're going to be a great resource for us. And I just want you to know that the members of UPAC, there's probably 30 members of UPAC. We are one of them. Many of the others are organizations like ours that are part of the Independent Parkinson's Network with us. And then on top of that, you have Davis Phinney, the Brian Grant Foundation, Parkinson Foundation, PMD Alliance. So many of the other national organizations are also a part of UPAC. And the idea is that we're all working together. We'll see. In the meantime, we can all work together. And I'm delighted that we have here Diane Balcom, who is one of the most important members of our team at Parkinson Foundation, Western Pennsylvania. She helps us raise resources, helps us with the awareness and community engagement project that we have, where we're trying to broaden the region's knowledge of Parkinson's disease. And she has worked in advocacy forever. And before I turn it over to her, let me also introduce Mark Giaquento. Mark is a longtime friend who we have some pretty funny stories that we can tell about each other. from our golfing together. But Mark, very successful executive, CFO of Children's Hospital, CFO of the blood bank that became Vitalant, started a foundation for them. I mean, the very, very, very successful career person. And he's the perfect person to help us run this advocacy team. So before I turn it over to Diane, let me just put one thing in your mind to keep in your mind. We really need this to be a coordinated effort. So they're going to run through the documents that I sent out this morning and talk about those. But in the event that you do anything, no matter who you touch, we'd like to keep track of that and share that with UPAC and the Michael J. Fox Foundation. These are the folks we've been in contact with and what we've shared with them. Everything from meetings with congressional people to phone calls to emails sent. So anytime you touch this topic, please reach out to Mark Giaquinto and Diane Balcom together and share your activity. Okay?
Okay.
So I will turn it over to Diane. And if you would like me to share any of the documents we're talking about, just put it in the chat or raise your hand and I will share my screen and bring them up.
Okay, thank you, Christine. Hello, everyone. I'm thrilled to see so many people on the call here at noon, and I know we'll have a good turnout at 7 o'clock as well. I was involved, my mom had Alzheimer's, and I was involved in advocacy for that cause for many, many years at the statewide level here in Pennsylvania. So I'm thrilled to be able to take what I learned during those years and bring it to PFWPA. We have a lot of different things, as Christine mentioned, that we are planning to target over the next few months or years. Some of them are going to take longer than others. But this opportunity came up right now to provide some support for House Bill 1135, banning the use of paraquat in Pennsylvania. And I did a little quick research on the bill itself, and it turns out that one of the main sponsors is a state rep from our area, Natalie Mihalik. So if she is your representative, when you contact her office, obviously she's going to vote for it. I think the message there will be thank her very much for bringing this to the attention of the General Assembly and for her efforts to bring about passage of the bill. Also, Representative Shaliba, who's from the Cranberry area. If she is your representative, again, that contact should be a thank you, not a request to support the bill, because she is one of the key co-sponsors. So we're lucky that we have a couple of people from Western Pennsylvania who are in leadership roles on bringing this bill to the General Assembly. We've been alerted by Michael J. Fox Foundation that this bill is going to be coming up for discussion and potential passage very soon. So we wanted to get started by having all of you contact your state House member. We don't need the Senate yet, but right now it's just the House, to ask them to vote for this bill. And just a little hint, when you contact the office, be sure to say you are a constituent. And if you do contact them by email, some of them have a system in place that does not accept emails from people who are not constituents. So don't use your work email address or some other address. Use your home address and your email will go through. And we provided a couple of documents to you. One is an overview of PFWPA that you can share with anyone in the office of a representative or the representative themselves. The second item is some talking points. We ask you not to share that. That's just for you. But these are things that we think will come as a surprise to many of the folks you're going to be talking to, whether it's a staff person or the representative themselves. And the first is that Parkinson's is the fastest growing neurological disease in the world. And within the United States, there are two areas where it is growing at a much more rapid rate than average. One is in California, pretty much in the central part of the state, which is the agriculture hub in California. And of course, paraquat, I believe, is banned now in California. But the other area that's part of the Parkinson's belt is what we would traditionally be thinking of as the Rust Belt. And that runs right through our region. And some of the reasons, in addition to paraquat, that bring about a higher rate of incidence here in our area are chemicals that were used in the mining industry, chemicals that were used in the mills and in specialty metal manufacturing. Uh, we also have an air pollution problem in this area. That's another potential trigger. And of course, we have one of the highest older populations in the country, concentrated in pretty much in Allegheny and surrounding counties. So we have all of these factors that make this a hotspot for Parkinson's disease. And it's very likely that the people you're going to be talking to have no idea of this situation. So that helps them to put it in a perspective of why it's so important to pass this bill. I think it's important for them to know also that we are locally based, that everything we do is here locally. We develop programs locally. We spend our resources here locally. We're not part of a national organization. And so we are directly engaging their constituents. And if any of them asks if you know how many people within their district have Parkinson's, let me know that. And I can look up through our database by zip code and tell you how many people in that district we have in our database. But that's a fraction of the people who have PD. We have been working with some of the drug companies to get data, again, private data, no names or anything like that, regarding prescriptions of certain drugs and procedures. So our best estimate on that is that there are 18,000 people identified through that process. That does not mean that's the total. That's how many we can identify. It's probably closer to 30,000. And then when you add that we also have services, counseling programs for their care partners, that's another 30,000 people. So in effect, we are serving at least somewhere in the range of 30 to 60,000 people every year, and it's growing. Yes, Christine.
Just one thing to add, that 18,000 is 22 counties in Western Pennsylvania. That's not
Right.
the entire state. So the entire state number is enormous.
Right.
And the other thing I want to highlight is that, in case you don't know this, we talk about it a lot, but paraquat is banned all over the world except in the United States. And it is produced, it's also banned in China. Now think about what China lets into their system, the lead, all the things that, we've tried to keep out. But they ban paraquat. They also manufacture it for us. And it's a frightening, horrible thing, but it's largely a result of a very strong lobbying effort from the chemical manufacturing industry. So I wouldn't be shoving that down the throats of our legislators necessarily, but know that this is something that the United States has turned a blind eye to for a long time.
Right. And I think also you don't have to be a farmer to have exposure to paraquat. I just saw something the other day about a high incidence of and risk for Parkinson's for people who live near golf courses because of all the chemicals that are used to keep those looking beautiful. That seeps into the water and that gets into the water system. So this is happening everywhere. Paraquat can even show up on the food that vegetables and fruit that you buy at the store. It just doesn't go away. So by banning paraquat, our state General Assembly and legislature can be taking a crucial, important first step toward reducing the risk for Parkinson's in this region, which has a higher than average risk to begin with. It's something that that really could affect every constituent that they might have.
You want me to take it from here, Diane?
Yes, thank you. Yeah.
Okay, Christine laid out my working career, but I'm 6 years diagnosed with Parkinson's, and that's really my driver here. Secondly, comment Diane just made, I'm 61 years playing golf and mostly walking the course, and I feel that had a lot to do with the diagnosis. So, what I want to cover in short fashion is sort of tips and rules for this initiative. And number one is that we want to focus our this initiative in your communication just about House Bill 1135, the banning of paraquat. We all have items that we have issues with the legislation. Leave those out of this. We have to, if we want to focus just on one, your letters or your conversation be just focused on the House bill. Second thing is, for this initiative, you don't have to contact the senators because it's a House bill, it's still in the House. So we want to focus your communication, your focus on the reps, the House reps. And the one of the attachments that Christine sent out this morning, the tips and rules of the road, it had two links buried in the email. One was it's how to get to the names of your legislators. So one is find my legislator. And if you type that in, it pops right up. You put in your home address, comes back and it tells you, here is your reps, your House reps. Here's your senators. Again, we're focused on the House reps. The second thing it does is it gives you their phone numbers for their offices, both local and Harrisburg. Gives you, if you want to use snail mail, their mailing address in Harrisburg, and also their local office. And then it doesn't give you, then there you can click on the email. You want to send an email and you get a message section. You type your message right there. So that's one option. The other option is to, as the attachment has, urge your state officials to pass Parkinson's research and care legislation. And this is through the Michael J. Fox site. Now the advantage, I found this one a little more difficult to use, just a little bit. Wasn't as direct. However, the beauty of this one is it actually has a form letter, a sort of a boilerplate that you can use, and then you just add to it. That's the nice thing about that. But either one of them will accomplish what we're trying to accomplish. So again, some of the points has already been mentioned today is use your home address. Again, only focus on the House Bill 1135. Don't bring anything else into play. I mean, we've at the conference, if you were at the conference, we talked about the registry being the number one priority. It still is the number one priority. However, the issue on the table is between the budget that has to get approved by June 30th for the start of the new state fiscal year and their plates are already full with bills that are lined up. I forget how many there are, 8 or 9. Is that right, Christine? You're muted. You're muted.
What?
I don't recall off the top of my head, but there's a lot
Yeah.
going on. I think it's more like 14 or something.
Yeah, so if we bring up the registry now, it's just going to get buried and we're going to lose our attention. So we want to keep the attention on the paraquat banning.
And
And
even
then,
if you really want a new stoplight outside of your housing plan, don't bring that up. Another call, make another call.
and then whatever you do, you drop a message to Diane and myself, letting us know what you did, who you contacted. That'd be wonderful so that we can keep a record and so we know in full what we've done. And then Diane and I will work on following up the way we need to follow up. And we'll have at our fingertips, there's been 10 letters sent, or there's been 20 letters sent, etc. So are there any questions from anybody? Okay, Christine.
Just a couple of more points. It would be really helpful if you could email information to folks who you know would be happy to support legislation that benefits Parkinson's disease in our region. So spread the word as much as you can. And um, there was something else, but I forget it.
Well, while you're thinking about that, I have one more thing. For the past 2 years, those of us at the office have all taken turns to be available to host information tables and be a part of various state representative and state senators' annual senior fair or health fair. So some of them do know who we are, but we've never yet asked them for something specific like this. So some of them may say, oh, yeah, I remember you guys had a table at my health fair last year. You know, I wanted you to know that, yes, we are doing a lot of that, but this will be the first ask that we've made. And I think it's important that we're starting on something that seems to be relatively simple and seems to have a great deal of support. And I think it's particularly noteworthy that other states are doing this. It's not like we will be the first. It's clear that paraquat is a terribly dangerous chemical and should never see the light of day. But it's there now, and it's time to get rid of it. But we have been working with these various legislators to try to increase their awareness of who we are and what we do.
And one last thing, and I did remember what I was thinking. If you have a personal relationship with a rep or a senator at the state level, do let us know. And if you have an interest in attending meetings with those reps, let us know. Let us know how you'd like to be involved so that we may maximize your talents and desires. Um, but yeah, any personal relationship we'd really like to capitalize on. Yes,
Yes, Marilyn.
Marilyn.
Do you have a copy of the House bill as it reads? Or where can we find that? Or can we find that?
It's online, but I can send it to you.
Okay, because I just wondered that sometimes they say they'll pass the bill, but it won't be effective for 2 years to give the people using it. And I think we should ask for it to be passed for immediate use.
Correct. I'll send that to you.
Thank you.
Kind of using the activity of Ohio and West Virginia to our benefit. There are 14 states who have a state registry approved. And only one of them is funded and actually working right now. But Ohio and West Virginia happen to be two states who have the registry approved, not yet working. But, you know, when West Virginia is beating us to the punch to ban paraquat, I mean, we should be highlighting that, right? Like seriously, guys, we're all Ohio, West Virginia, and Pennsylvania are in this Parkinson bucket where the numbers are higher than average, and let's take action. That's it.
Christine, can I ask a question about that? For
Sure.
the registry for the zip codes, who is responsible for that in a state? Would it be the House or the Senate or some other organization?
It would have to be approved by both the House and the Senate, and it would be enacted into law. And as part of that, we would have to finalize the legal documentation about what information is collected. We are trying to find out zip code, gender, things that will help us draw some conclusions about Parkinson's in our state. Already, Michael J. Fox Foundation and we have participated in trying to get research monies approved. And it's not just for Parkinson's, it's for MS, ALS, and Parkinson's. And we were successful in getting $3 million approved in the budget for that. Now we are working with the Michael J. Fox Foundation to get an additional $10 million. And our thinking, our hope is that when we talk to these legislators about the registry, that, and again, we don't want you doing that right now, but our hope is that some of that $10 million, as Diane says over and over, if we're going to be doing the research, we need to know where the people are who have PD. So part of that $10 million we're hoping can be the funding mechanism to put the registry in place. But then we're at the mercy of every county in the state putting together the infrastructure to collect that data.
Oh,
Yeah.
thank you.
If there's no other questions, I'll let you get back to your lunch hour. And thank you
Thank,
guys for getting on the call.
Thank
thank
you
you
all
guys
so
for your
much.
efforts.
Thank you.
Thank you.
Bye.
Bye.
Bye-bye.
See you. Love you. Bye.